Human metapneumovirus HMPV is a respiratory virus that has been increasingly recognized as a significant cause of illness in both children and adults. Despite its impact on public health, HMPV remains less well known compared to other respiratory viruses, such as influenza or respiratory syncytial virus, RSV. Understanding this virus, its symptoms, transmission, and prevention measures can help individuals and families better protect themselves, particularly during cold and flu seasons when respiratory viruses are most active. In this guide, we'll explore the key aspects of HMPV, including how it spreads, who is most at risk, and what you can do to minimize your chances of infection. What is HMPV? HMPV was first discovered in 2001, although studies suggest that it has been circulating in humans for decades. It belongs to the family Paramyxoviridae, which also includes RSV and parainfluenza virus. HMPV typically causes respiratory tract infections that can range from mild, cold-like symptoms to more severe illnesses such as bronchitis and pneumonia. The virus is commonly seen during the late winter and spring months, similar to other respiratory viruses. Because of its overlap with cold and flu seasons, HMPV is often underdiagnosed or mistaken for other viral infections. Symptoms of HMPV. The symptoms of HMPV can vary widely depending on the individual's age, overall health, and immune response. Common symptoms include cough, nasal congestion or runny nose, fever, a shortness of breath, and sore throat, fatigue, wheezing. In more severe cases, particularly among young children, the elderly, or individuals with weakened immune systems, HMPV can cause lower respiratory tract infections leading to bronchiolitis or pneumonia. Hospitalization may be required if the infection leads to significant breathing difficulties or complications. Who is most at risk? While anyone can contract HMPV, certain groups are more susceptible to severe outcomes. 1. Infants and young children. Since their immune systems are still developing, young children are at higher risk of severe respiratory infections. 2. Older adults. Immune function tends to decline with age, making older adults more vulnerable to complications. 3. Individuals with chronic conditions. People with underlying conditions such as asthma, chronic obstructive pulmonary disease, COPD, or heart disease may experience worsened symptoms if infected. 4. Immunocompromised individuals. Those undergoing treatments that weaken the immune system, such as chemotherapy or organ transplants, are at increased risk of severe infection. How is HMPV transmitted? HMPV spreads in ways similar to other respiratory viruses. Transmission occurs mainly through respiratory droplets expelled when an infected person coughs, sneezes, or talks. The virus can also spread by touching contaminated surfaces and then touching the face, particularly the mouth, nose, or eyes. Close contact with an infected person, such as living in the same household or sharing personal items, increases the likelihood of transmission. Diagnosis and testing. Because the symptoms of HMPV resemble those of other respiratory infections, a definitive diagnosis requires laboratory testing. Doctors may collect samples from the throat or nasal passages to detect the presence of the virus. Common testing methods include polymerase chain reaction, PCR tests, which are highly sensitive and can identify specific viral genetic material. For individuals with mild symptoms, testing may not always be necessary unless there is concern about potential complications or if hospitalization is required. Treatment options. There is currently no specific antiviral treatment for HMPV. Instead, management focuses on relieving symptoms and supporting the patient's recovery. Common recommendations include rest, allowing the body to recover by getting adequate rest. Hydration, drinking plenty of fluids to prevent dehydration, especially if fever is present. Over-the-counter medications. Medications such as acetaminophen or ibuprofen can help reduce fever and relieve pain. However, these should be used according to age-appropriate guidelines. Humidifiers. Using a humidifier can help ease coughing and soothe irritated airways. In severe cases, particularly those involving respiratory distress, hospitalization may be required. This can include oxygen therapy or mechanical ventilation to assist with breathing. Prevention strategies. Since there is no vaccine for HMPV, prevention relies heavily on limiting exposure and practicing good hygiene. Some key prevention measures include 1. Frequent hand washing. Washing hands thoroughly with soap and water for at least 20 seconds is one of the most effective ways to prevent the spread of the virus. 2. Avoiding close contact. Limiting close contact with individuals who are sick can help reduce transmission. 3. Disinfecting surfaces. Regularly cleaning and disinfecting high-touch surfaces such as doorknobs, light switches, and electronics can help prevent the spread of respiratory viruses. 4. Cough and sneeze. Etiquette. Covering your mouth and nose with a tissue or your elbow when coughing or sneezing helps prevent the spread of droplets. 5. Staying home. When sick, individuals who are experiencing symptoms should stay home to avoid spreading the virus to others. Potential for future vaccines and treatments. Research into HMPV is ongoing, and scientists are working toward the development of vaccines and antiviral therapies. Similar to advances made with RSV vaccines, there is optimism that HMPV prevention efforts may see significant progress in the coming years. Until then, awareness and preventive measures remain critical. Human metapneumovirus may not be as widely known as other respiratory viruses, but it poses a real risk, particularly to vulnerable populations. By understanding how HMPV spreads, recognizing its symptoms, and adopting preventative measures, individuals and families can better protect themselves during peak respiratory virus seasons. As research continues, there is hope that future developments will bring more effective ways to combat this virus. In the meantime, simple actions like hand washing, disinfecting surfaces, and staying home when sick can make a significant difference in reducing the spread of HMPV and other respiratory infections. Awareness and vigilance remain key to protecting public health and promoting faster recovery for those affected.